When Zach was about 6 days old, we got a call from Judy Miller here at the Pediatric Specialty Clinic at the UI Children's Hospital, and she informed us that his newborn screening came back positive for MCAD deficiency. It's a fatty acid oxidation disorder, and basically his body can't break down the fat stores. So if he's not eating, vomiting, diarrhea, he just can't break down those stores to produce energy for himself. And I remember the call, first time mom, and it's, again, 6 days old, and she said, I'm going to give you a website to look up, but I'm going to warn you, it's very scary. And when I pulled up the website, it said 1 out of every 4 babies die from it. And my heart just kind of sank. So I would say probably within the week, we came down to the university and we saw Judy Miller.
Zach first came to our clinic when he was just a newborn. He had a screen that all babies in the state of Iowa have shortly after birth, and it identified that he had a condition called MCAD deficiency. In MCAD deficiency, you're missing the enzyme that helps your body use fat for energy, which is what you do if your body doesn't have enough of the glucose. And so kids who are born with this genetic condition, if they have a prolonged period of fasting or if they have a vomiting type illness, they have to come into the hospital to get some IV glucose to get them through the illness. Future for Zach is very bright. We expect that he will continue to do well. And again, just with some ongoing education and precautions, he should live a very normal life.
UI Children's Hospital has done a great job educating us, and that's been our biggest weapon for keeping him healthy. I think their education and arming us with that information was the biggest thing they could have done for us. Zach's a very energetic child. Right now, he pretty much leads a normal life, very active in sports. He has developing a sense of humor these days, and definitely an adolescent. To Judy Miller, the whole staff, and there was a committee from the University of Iowa that fought for the expanded newborn screening. I would just want to say thank you to them, because honestly, without them and their push for the expanded newborn screening, we wouldn't know Zach had MCAD deficiency, and he may not be here with us today. When he got sick at 4 months old, he probably wouldn't have made it through that. Anytime they need somebody to fight the fight for them to keep expanded newborn screening, I'll be right there with them, because I know it saved my child's life.